My name is Dr. Karl Stajudar. I'm the Chief of Cardiovascular Services at Cape Cod Hospital. In cardiovascular medicine, there have been amazing advances over the past, 10-15 years. A lot of these advances, though, have been in individual specialties such as surgery or interventional cardiology. And we have not done as great of a job as we should talking amongst the specialties. So the heart team approach looks to try to break down those barriers. Instead of being in silos, we meet as a team and really try to have at the center of this the patient. So the heart team at Cape Cod Hospital consists of the patient's cardiologist, the cardiac surgeon, the interventional cardiologist, imaging specialists in cardiovascular care, rehab medicine, and nursing. As I said, the patient and their family is the center of this. So when a patient comes in with a particular problem that is either complex or could be approached in many different ways, the team evaluates the patient, looks for a series of options that they can present to the patient and their family, and spend a good deal of time educating the patient and the family on what those options mean, what the expected benefits and risks may be. And then with the patient's goals of care in mind, or at the center of this, a treatment plan is designed, and all the members of the team have input, and they are all committed to making the treatment plan succeed. Specialists in all aspects of cardiovascular care are part of the team and have input in the patient's treatment plan. The team educates the patient and their family regarding the treatment plan, the alternatives, the expected benefits and risks, and spend a good deal of time making sure that the patient and the family understand these concepts to make appropriate choices in terms of healthcare. The patient's cardiologist acts as an honest broker, keeping the patient at the center of their thoughts in regards to treatment options. And finally, the heart team strives to provide continuity between the hospital and the patient's outpatient cardiologist or rehab center or nursing and follow-up care. John S. is a 65-year-old male who is followed by Dr. McAuliffe in the Cardiovascular Center. John has a history of atrial fibrillation, for which he is on a blood thinner, and has been followed for a murmur by the condition aortic stenosis. John has been doing well, but more recently he's been having shortness of breath. And then he has a fainting episode. He calls Dr. McAuliffe. Dr. McAuliffe recommends that he comes to the emergency room for further evaluation. John comes to the emergency room, is seen by one of our emergency room providers, and because of the compelling symptoms of fainting and the setting of this murmur aortic stenosis, he is admitted to the hospital for further evaluation. One of the first tests that he has done is an echocardiogram, or an ultrasound of the heart, and this confirms the diagnosis of aortic stenosis. Aortic stenosis is a blockage or a narrowing of the outflow valve of the heart, and if untreated, progresses to create symptoms of fainting, of chest pain, of heart failure, and if left untreated, even the patient's death. Because of this compelling symptoms and findings on the echocardiogram, the patient is referred to the heart team for further evaluation. The patient is seen by one of the hospital cardiologists, an interventional cardiologist, a cardiac surgeon, and imaging specialists are involved in his care as well. The patient has additional testing, such as CT scans and a coronary angiogram, to help figure out what additional problems that the patient has that need to be addressed at the time where his valve is addressed. Really, the only option that we have is valve replacement. And the two ways of valve replacement are surgical, and open heart surgery, where additional procedures can be done, such as the Maze procedure to treat the atrial fibrillation that John has, or clipping a portion of the heart that's involved in blood clots so that he may be able to come off blood thinner. Valves can also be placed by interventional cardiology using catheters to deploy the valve. This is called TAVR. And additional procedures such as putting in a stent can be done as well. John is right at the age where both of these options are appropriate. And so the heart team meets to figure out what is the best approach for him, educate John and his family, and really try to align what we can do with these procedures with the patient's goals of care. John decides on surgery because he can have the complete procedure in terms of the valve replacement, he can have treatment for the atrial fibrillation that he has, and he can have that clip procedure that may allow him to come off blood thinners. John has his surgical procedure and does quite well. He's discharged from the hospital after 4 days, and the team ensures that he has services at home to include physical therapy. John also sees Dr. McAuliffe in follow-up, where an echocardiogram is arranged to provide a new baseline after his valve replacement, and Dr. McAuliffe recommends cardiac rehabilitation. This is a program of supervised exercise and education that benefits John greatly.